Good afternoon, everybody. I'm really delighted to be here and so grateful to have been asked to come and talk to you about this. It's hot off the press. I've just been made a professor. So there you are. This is even more to it since then. And then I was really excited because Nigel said, that he's been asked by the organizers to tell you to exercise. And I thought, this is brilliant. My job's done. I don't need... And then he said discretion after that. So it's a bit dull. I thought that's it. The whole organization here is asking us all to exercise. Brilliant. Anyway, so the story is, I'm here to talk to you about some of the insights that we've had in exercise testing and prescription at Great Ormond Street Hospital and the Institute of Child Health, and some of the experiences that we've had. And I'm not going to make it, I've sort of chopped out all the confidence intervals of the complicated talks, although Nigel said that he's got a scientific background. There's probably a whole lot of other serious scientists in the room. But I'm going to try and keep it a little bit light, and we'll start with what I think of as my kind of big inspirational slide. So as a pediatric physio, we kind of start with the guy in the middle, a whole lot of potential and not much else. And around the slide here are a whole lot of incredibly inspirational people with cystic fibrosis. And you'd kind of think inspirational people with cystic fibrosis might be indulging in the academic, and indeed the sort of top two left are a singer-songwriter and a fantastic musician. But actually, all the other people at CF here are these magnificent physical creatures. And it just reminds me of our job in trying to get the potential out of every single child with cystic fibrosis. We've come a long way from that time when we used to say, well, if you're coughing in your a gym class at school, you should sit out from this exercise session. Far more aggressive approach to keeping healthy and fit these days. And then I wanted to add, because 2 days ago I had this magnificent experience, and I think this guy is a bit of a celebrity in Sydney. I don't know if you know him, but he runs this fantastic thing called Blue Bananas, which is an electrical bicycle company that has tours around Sydney. And he started the company when he was getting really breathless, with his cystic fibrosis. And then he had a transplant this year, so he's no longer breathless, but his tour company is fantastic. And he's just absolutely, this is him 5 weeks after his lung transplant and back at business and taking people around Sydney. So massively inspirational people. So it's here we are, some dull information for you to know about. Why is exercise testing important in cystic fibrosis? And you'll know by now that exercise and physical activity are core components of physiotherapy management in cystic fibrosis. And we also know that if disease progresses in CF, that inevitably will reduce exercise capacity and ability to function properly. So we need to have some sort of a proper objective assessment of fitness and exercise capacity in CF, and the CF Trust guidelines are such that they say this has to be a standard of care for everybody, and we take them very seriously. The nuts and bolts of this is why. We want to know, well, are our therapeutic interventions working? We want to know what your exercise capacity is so that we can assist you with training. We want to know what the disease progression, or indeed, some people argue that exercise capacity is an excellent indicator of prognosis. So all those reasons mean that we have to find some tools that are really good at testing exercise. And these are some of the ones that we use for children. Some of the, they may be familiar to some of you or not, but at the top we've got a 6-minute walk test, and that's a test where you're supposed to walk as far as you can in 6 minutes. And the standardized test suggests that, I don't know if this is the, suggests that you should have a 28-meter corridor, and not many people have a 28-meter corridor handy, so that's a pretty tricky test to do a lot of the time. Also, if you tell somebody to walk as far as they can, it's a kind of volitional test, so it means that if you're feeling a bit slack, you might walk a bit slowly. So it's called a submaximal test, and it isn't something that tells you how much you can do. Similarly, there's this thing called the 3-minute step test. Although it is timed, you stop after 3 minutes, and that isn't a very maximal exercise test either. So we tend not to use these two very much. And then we've got a thing down here called an incremental shuttle walk test, and that's the beep test. I guess it's familiar to lots of people. But there it gets harder and harder. You've got to run and run and run even faster until you eventually fall over. And you only need 9 meters of corridor for that. So a lot more people have that length of corridor, and we use this test quite a lot more often. And then there's this nasty business called CPET, which is a cardiopulmonary exercise test. And you've got all this kit all over you. You're measuring ECG here, so how your heart's working. And you've got this, which is measuring the gas coming in and the gas coming out, so you can see whether or not you're using oxygen properly. So there's all of this stuff that goes on here. But you can imagine there's quite a lot of schlep involved with doing this test. So we're always trying to work on ways of testing accurately what exercise capacity is, and I'll tell you a bit about a test that we've worked on in a minute. But in the meantime, I'm going to give you just an insight into, and you know what, many of you will know this insight anyway, but what life is like sometimes for a child who has to come in and get some testing. Have a look and see, and we'll chat afterwards.
These questions are for children like you who have cystic fibrosis. Your answers will help us understand what cystic fibrosis is like and how your treatments help you. So answering these questions will help you and others like you in the future. So let's ask you a couple of questions here. So during the past 2 weeks, you were able to walk as fast as others. Very true, mostly true, somewhat true, or not true at all? Mostly true? Okay. You were able to climb stairs as fast as others. Very true. Perfect.
27.10.
Perfect. Right, let's see how many you've got. This one over here. Thank you. There we go. Gonna shuffle behind your head. There we go. Oh. Keep looking straight ahead. That's it. Breathe in. Breathe out. Nice and steady. Keep nice and still and nice and tall. There we go. There we go. Down there. Sit nice and tall. Back straight. Perfect. Big breath, block, keep going, go, 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 right to the end, keep squeezing, squeeze, 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 a little bit longer, push, 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 keep going, and then when you can't go anymore, big breath, well.
My name is Rebecca, I'm 11 years old, and I'm going to do 2 tests, the bleep test, and this is the cycle test.
That's just to hold that tube in front of your mouth so that we can measure all your breathing when you're exercising, okay? So it's just going to sit nice and snug on your face there, and you've got that big hole in the front to breathe through. For you? So, wriggle it up on your face a little bit. There we go. How's that feel? Is it okay? Look at that big hole in the front there. Make sure it's right in front of your mouth. Okay. Excellent. And then the last thing, we're just going to put a little probe on your forehead, a little sticker. And that's going to stay in place with a little sweatband. So it's going to stick right on your forehead here. Here we go. Doing really well, Rebecca. Perfect speed.
My name is Anish. I'm 8 years old. After all the lab tests, I'm trained in the gym like this.
Up nice and tall. Good boy.
My name is Daniel and I'm 10 years old and I'm a really fast sprinter.
Go on then, off you go.
That's how you sprint, just like me.
So some insight there into the world of pediatric exercise testing and carrying on. What was quite interesting though, you saw two tests there. One was that shuttle walk or the beep test. That's the MS modified shuttle walk test, and that's in the second column over here. And here's the CPET test over here, and that's the one with the mask on the face. What we found out is these are ages of children all the way down here, and the number of kids that we tested. What we found out, because children don't behave as they should all the time, what we found out with the CPET versus the modified shuttle walk test, that we're able to get a far higher maximal heart rate out of kids who are running. And it turns out that that's really a lot different in the 6 and 7 year olds, and we're finding that for whatever reason, and we discussed this next door, kids were finding it's called a modified Godfrey protocol, and that means that there's this kind of exercise ramp on a bicycle that youngsters of 6 or 7 find really quite hard to do. And so that was quite interesting, having tested the data like this. We were able to tell that the red line here at the bottom of the graph shows the maximal heart rate for 6 and 7 year olds, and this is what it should be for 6 and 7 year olds. So that's a test that's not very good for youngsters, and it's a little bit better for us to do testing on a modified shuttle walk test. That's the running up and down the corridor. But if your exercise lab has got a treadmill, then it turns out that you'll probably be able to achieve, even in 6 and 7 year olds, a maximum heart rate that's near close to where we expect it to be. So that's a good thing. Here's another thing we've been up to, and which, not everyone's got a big corridor or a CPET lab. So we've been trying to develop a test that you could use in schools or at home, and if you want to find out how well a child with CF is doing, you want to be able to do it without all the kit and without all the corridor space. And so this is somebody called Sarah Rand, and she works with me. And we've been trying to work on this test together, but then she went and cheated and had this fellow called Charlie, and so she's kind of out of functioning at the moment because she's validating this other youngster instead of doing this step test. So she'll be back in the fullness of time. The test that we wanted to work on was something that had to be portable, it had to be easy to administer, it needed to be standardized so anyone around the world could do it, and it needed to kind of get the heart rate up more than some of the 6-minute walk or the 3-minute step test. So that was our challenge. And so we did this, and it was a funny, we called it the ISTEP, and this isn't about Apple products, it's about the incremental step test. And we didn't want it to be hard for really short kids, so what we did was say, well, you have to use one of these commercially available steps, and you can adjust the height. And as long as it's sort of mid-tibial length, it means that whoever's doing the step test won't find it harder than a taller or shorter person. So that's how it works to start off with. And here's what we came up with. It's a foreshortened, it's a 10-minute step test, and I'm going to show you a couple of seconds of each of the levels in it. So don't think it lasts only as long as this video. It goes on for the full 10 minutes and makes you really quite weary. There you go. So that's the way the ISTEP looks. And in fact, we can't get it much more than that in terms of steps per minute without making it really hard for a kind of uncoordinated youngster to do. About 44 per minute is about as far as we could go. Then we wanted to check, well, is this ISTEP that we've just developed just as good as one of these CPET tests in terms of getting the heart rate right up? And so we made the kids do both of those tests on the same day to see how they compared. We also, apart from measuring heart rate and all the other kinds of gas analysis and VO2 peaks that we could do, we asked them to say, well, how tired did these tests make them? And this is called a children's Omniscale. And sometimes if you say, well, how tired are you? Kids don't understand. So they're these kind of pictures that anchor with words exactly how tired. And these pictures show that, when you get really, really tired, the fellow on the picture up close looks completely exhausted. And then there's a step test one down here. So children were able to tell all the way through the exercise how tired they were getting on. So 24 kids, half of them were boys, and they were about 11 years mean, but they varied between 6 and 15 years, and the height about 1.5 meters. And they all did both tests. And this is the kind of take-home message test. And all children achieved at least 2 levels, and about half the children managed to complete all 5 levels. And here's the CPET over here. So that's the one with the mask. And here's the ISTEP over here. This is the maximal amounts. Now over here, the p-values, and some of you will know what that means. But the idea is that you want the p-value to be you want the p-value to be bigger than 0.05, because that means it's not significant. What you really want between these two tests is that they are not significantly different. So none of these are significantly different, except for this guy over here, which is called an RER, and that is the respiratory exchange ratio. And what that is the amount of carbon dioxide produced over the amount of oxygen consumed. And that tells you a bit about gas exchange. But in all other of these variables that we're interested in, these two tests were equivalent. Quite nice to know that, because you can go out into the community and make a child exercise, and you know that you're getting them really close to their maximal exercise capacity, even without all of the kit available. So that's quite useful. This RER, I'll get back to in a second, but near maximal physiological exercise achieved by all participants, including the kids that completed the test and indeed those that stopped the test a little bit earlier. So it looks like a really promising test. It's portable, standardized, all of the things. There are no ceiling effects for people. They weren't clustered all at the top results of the test. And so we think it's a promising test, and we're going to keep on looking to see if it fits the bill. But that's as far as we've got so far. This RER, we're not really worried about, but it suggests both of them were above 1, which meant a maximal exercise test. But this suggests that in a small minority of very fit kids, you're probably more likely to reach an anaerobic threshold during the CPET and not the STEP test. But actually, in terms of functional near maximal capacity test, this is quite a good one. So why is exercise prescription important in children with CF? We think it's going to help maintain or increase lung function. There's some evidence for that. We think it's going to help with airway clearance, and there's some evidence for that. We think for sure it's going to improve aerobic capacity in bone and muscle strength. Definitely evidence for that. But the thing that we think is really quite important is this improving self-confidence, facilitating exercise as a lifelong habit, and indeed improving quality of life. Also, there are issues here about increasing insulin sensitivity and helping with carbohydrate metabolism, which are also helpful side effects. So Great Ormond Street in about 2010 had this sort of grand scheme, and I think it was on the basis of a poster that was presented in Australia with an Australian team. It was about frequent flyers. And the idea was that kids who end up in hospital more than 40 days a year, and this is what we worry about a bit. You know, people, they keep coming back to hospital and having antibiotics. We don't want them to do that, and we call them frequent flyers, and we wanted to see what would happen over a course of the year if we went out and had a supervised exercise program once a week for all of these kids who were frequent flyers. And you know, this is a whole nother talk in itself, but here's a kind of take-home message for that. This is the number of intravenous antibiotic days, and this is before the intervention, after the intervention, at GOSH, at home, in shared care, and this is the total at the end. This is the cost of healthcare in British pounds, and again at GOSH, shared care, at home, and the total afterwards. And there were quite significant improvements in these really quite sick children. There were 14 of them on the program. And in 14 children, there was a cost saving to the hospital of some £220,000, which is quite a big deal, because sending somebody out to do the exercise once a week and having half a dietitian on board cost a good bit less than £100,000. So it was still, you know, money's not everything, but actually it was an intervention that was really quite helpful to these children and had a cost benefit. So here's one of the fellows that was on the program, and he's Tom Murphy, and he, I think you might see exercising a little bit later on, and he had a small interview with a local newspaper, and this is what the text in that newspaper came up with. The kind of boring stuff at the top: lung function increased by 13%. Now in hospital for an average of 25 instead of 69 days. And he has, and on average, the NHS has saved £13,000 per patient. But actually the stuff that's important I've put in red, which is I feel a lot better and everything is more normal now. He says, it's brilliant having to be in hospital, not having to be in hospital quite so much, as I can see my friends and keep up with my schoolwork. His mum says, improvement in him since the frequent flyer has been remarkable. He loves the exercise. He's happier, healthier, and definitely more enthusiastic. And then this bit down here: there is no better reward for Tom's efforts than to see him as active as his friends. And that was quite a, you know, those are important personal statements in relation to this program. We don't always capture that with our data collection or exercise testing. And so as a result of that, scientists don't like it when you observe a nice, happy phenomenon like that. They want to make sure that it's a proper thing, so they always want you to do a randomized controlled trial where only half of the people get the thing and the other half don't get the thing. It's a whole nother talk about how I feel about that. But anyway, Sean Ledger up there and I got a big grant, so £450,000 to do this as a randomized controlled trial. So it wasn't the frequent flyers anymore, it was all the children with CF in our clinic. And the idea was that we would have this intervention, which is a weekly supervised, prescribed exercise program. And this would go on over 2 years. And we're coming towards the end of that 2 years. It's flown by, and I think there are 5 youngsters who were late enrollments who were still waiting to come in. And then we'll be able to tell you what the results of that program are. But in fact, there's some really promising stuff that's there. So there are important things in exercise prescription, and you'll hear people talking about it's called FIT, and that's frequency and intensity and time and type. And those are the things that are important in prescribing an exercise. And so in terms of frequency for this program, we obviously want children to be active every single day, but quite important to have a structured and focused exercise program that gets your heart rate up at least 2 or 3 times a week, and make sure that you're fairly active on the other days. And so we were only able, with our grant funding, to resource a fully active single supervised session, but we had this set up with the Nuffield gym centres all the way across the UK, and they said that your CF patients can have a free gym membership, and one family member can come with them to the gym and also have free membership. And if you can find somebody like Nigel here to negotiate that in your in your state, then that's what you might be able to set up for your patients. So frequency, we did it once a week with these kids. What about intensity? That's normally prescribed on the basis of a number of things, but we used maximal heart rate. So we went and did an exercise test on all these kids, and we said, what's their maximal heart rate? And then we made them do their prescribed exercise as a percentage of that. And if they had an FEV1 that was less than 55, then we made them exercise in a range between 60 and 80% of their maximal heart rate. And if they had an FEV1 that was a little bit higher than that, we made them exercise between 70 and 85 of their maximal heart rate. What about time? And this is a standard exercise prescription thing. Somewhere between 45 and 60 minutes. There was always a warm-up session, and you use big muscle groups. Major joint complexes move through their normal range of movement. Conditioning period, and for us that consisted of 4 things. It consisted of an aerobic exercise, some strengthening work, and you'll see a video of that in a little bit, and some core strengthening, which is important, but also there are quite a few musculoskeletal problems that happen with CF around about the thorax in time, so we had a lot of stretching involved in there too. And then, as normal, and as you'd expect, a 10-minute cool-down period. What about the type of exercise? Well, usually the aerobic type of exercise is usually continuous, or it's interval training, and people talk about high-intensity interval training, and that means that you work really, really hard for a period of 1 or 2 minutes, and then you have a kind of a rest where you slow down and walk for a little bit. And we used the high-intensity interval training. And the reason we did that was some kids who are a bit breathless in between, if they know they only have to work really hard for 2 minutes before they get a bit of a slowdown, they're far more able to engage. And in fact, there's some evidence to suggest that you get greater training effects, cardiac and strengthening effects, if you use high-intensity interval training. So we had that as part of our program. And especially, that works better in deconditioned patients. So another video, just to kind of give you a flavor of how it all looked. And some attitudes.
And what do you think about exercise?
It's healthy.
Are you enjoying it?
Yes.
What do you like most about exercise?
Swimming.
Swimming? How about the weights? Do you enjoy weights?
Yeah.
What do you think about the treadmill?
I prefer running outside than I do in treadmill.
Okay. So, Abby, tell me what you think about exercise. Why don't you like it?
Because I don't like treadmill.
Why do you think we're exercising?
It's getting better.
So, Justin, tell me what you think about exercise.
Fun at times when you're not tired.
What don't you like about exercise?
The bits afterwards, being tired.
So, Tom, tell me about what you enjoy about exercise.
You feel good after it, I guess, and it helps you.
What do you dislike about exercise?
It can make you quite tired and a bit weak.
Exercise is boring!
Do you have any other comments? Do you like working out with me?
Sometimes.
What don't you like about exercise?
It costs me now.
Do you get really breathless?
I get breathless.
Do you enjoy running?
Not that much.
How are you feeling?
Tired. But I need to do it. And it's good.
Two to go. Don't smile. Do you enjoy exercising?
No.
Do you like anything about exercising?
No.
Do you like being on the treadmill?
No.
Do you like working with me?
Okay.
So it's okay. Do you enjoy coming to the gym?
No.
Do you like swimming?
No.
Is there anything you do like?
No. Oh yeah. Sitting at home.
Yeah, so some of the challenges, I tell you. So a little insight into what's been going on and how we test and exercise young people with cystic fibrosis. Very happy to take any questions if there are any. Or it might be that we have to wait until after.